Healthcare has been on a lot of people's minds in Washington over the past few years. Today, it's top of our minds too.
My main role is to make sure that we align the actual up-to-the-moment issues and trends in healthcare with some of the analytic capabilities that SAS excels at.
What kind of message do you want to get out to the audience that is attending today?
Well, there's so many big data initiatives in the federal government right now. I think one has to be very, very careful not to presume big data automatically needs to be a big warehouse. What's more important is that you use predictive analytics to gain insight immediately upon receiving new sources of data so that you can actually make an incremental change from day one of the project. Now, big data really seeks to bring those already captured data sources together first, gain insight from that, and then expand upon new data sources.
What kind of possibilities do you see going forward?
Organizations begin to morph and collaborate more closely. You're going to see more federal agencies, state agencies, private insurers, and private healthcare providers join together to merge their information so they can better make sure that the patient is first and foremost at the center of care, cost, and quality.
What kind of myths are still surrounding the whole big data concept?
I think the biggest myth is that it is something that takes 4 or 5 years to capture and bring together. Organizations that are really attuned to using new core technologies in terms of like text analytics, using unstructured data, understand that you can gain immediate return on using that data versus trying to necessarily take 2 to 3 years to build the data together.
You don't always think of government as being responsive to new technology. How do you change that?
That's a great question, and I would also say that in healthcare, too often, healthcare has been a lagging industry in terms of taking advantage of modern technology in terms of analytics. Healthcare now has jumped on board. The Affordable Care Act is certainly changing the way patients and physicians are incented and how the system is now being changed to deliver care. So I think at the end of the day, the rules and regs now require new insights that they've never had to respond to in the past. So it's not so much entrepreneurship as keeping up with the private sector.